Hey everyone, good afternoon. Nathan Kolar here from the CG Zest Wellness team, and we'll get started in about 30 seconds, I'd say. We'll allow more of you who registered to come into this webinar room, and then we'll get started. I'll share my screen, and we'll begin the webinar. All right, everyone. So what we're going to do is we're going to get started nice and slowly for this webinar, which I'm really excited about to share with all of you. And you can see my screen right now. It's the title page of this webinar. And our topic is all about pain management, with our subtitle being Identify, Track, and Enact. And I think if there's one word to describe this webinar in terms of what your takeaways are, what our goals of this webinar on behalf of the CG Zest Wellness team, I would say would be to empower you. So if we could, and we are going to share some pieces of education, some tools, some practical tools for you to empower you for your health journey in terms of today talking about pain management. And so what we'll do is we're going to move on to the first slide here, which is all about kind of first and foremost defining our terms. And so we have acute pain and we have chronic pain when we talk about pain management. And I'm sure many of us are familiar with acute pain in terms of something that's, we know exactly what happened. It has a kind of a defined start and end time. Could be, a broken bone, a cut of some sort, this kind of acute pain. But we also have chronic pain, and which can be frustrating and lead to compromises in quality of life for individuals. We can't put our finger on when it might have started, and it was gradual. And so that's what we're really focusing on today. And so chronic pain can be something along the lines of back pain, of headaches, migraines, of arthritis and carpal tunnel syndrome, which we're also going to talk about. So first and foremost today, as we define these terms, as we're moving on, we're talking about chronic pain and how that can really be a barrier when it comes to your well-being. And from us at the CG Zest Wellness team, we're always thinking about different types of topics to deliver with these webinars. And one of the sources of insight or inspiration to do this webinar in the first place on this topic of pain management was when we look at our health check data within Virgin Pulse. And so many of you can do the health check assessment through Virgin Pulse. When we look at our data, we can see from our client population, all of you, is that individuals certainly are living with chronic pain in various areas of their body. So we know chronic pain is prominent. And then we do know that it's one thing if you have chronic pain, another thing of how you manage that chronic pain. And so for both of these kind of factors, we do see a spread of individuals who do have chronic pain. And then in terms of individuals who might only be managing their chronic pain fairly well, or even some individuals not well. And so we see this as an opportunity when we look at our aggregate health check data to say, hey, when we create a new webinar, this is the type of topic that we should do to help people. And so we're trying to learn everything we can from you in order to deliver sessions like this. So it gives some background on why we're here today and the importance of pain management for our well-being. And to get started here, how do we spark action? Well, you can see in this evidence-based diagram from the literature, you can see it can be almost like a spiral of, if you have an injury, if you feel pain, but you're in a state of denial or frustration, and then it could be a loop of, okay, then you don't do anything to move forward and treat your pain, and it kind of circles to be something that magnifies in severity. And so we could also confront our pain, and that helps lead to recovery. So when we look at an image like this, we want to be on the right side of it where it says low fear, confrontation, recovery versus any sort of avoidance of the pain, which can just lead to some negative side effects. And so it's one of those things where we want to confront our pain, use it to for us to be curious, because we know through our well-being and through our wellness habits, we can do something with our chronic pain. And so the image with the message with this slide is we want to lean into our chronic pain and get curious about it, because I'll tell all of you is that we tell individuals who are trying to help with their wellness is self-care is not selfish. So remember that self-care is not selfish. And so if you have chronic pain, you can certainly learn from our webinar and certainly use our wellness tools to do everything we can to help you on that journey. But the first step is taking those steps yourself and confronting the pain. Now, we're talking about pain, and much of today's webinar as well will be on this idea of the musculoskeletal system, so pain in terms of our muscles and bones. And so here's a little bit of a background slide on the musculoskeletal system, sometimes called simply the MSK system. And it includes bones of the skeleton and the cartilages, ligaments, and other connective tissue for our body. And actually, I'll ask all of you right now, if you think about it, in a few moments, we're gonna have some poll questions, but if you think about it, how many, do you actually know how many bones we have in the human body and muscles? Because I'll tell you, we actually have 206 bones in the human body and around 600 muscles in the human body, which is amazing. And so these muscles and bones, part of our musculoskeletal system. Of course, the functioning of these muscles help us to sit, stand, walk, run when different muscles contract and they produce movement in our body. And then what goes along with the musculoskeletal system is MSDs, musculoskeletal disorders. And so you can see from this list here, arthritis, repetitive strain injury, tendinitis, low back pain. And so these are kind of adverse health conditions of the musculoskeletal system referred to as musculoskeletal disorders. And so that's what the bulk of our webinar today is going to be in regards to. Here we have our next question here being an audience poll as we warm up with this webinar. And so you can see the question on the slide here, and think as you're going through this and you're picking out these different options, you can think between three factors: force, repetition, and posture in terms of the musculoskeletal system. And when you're sitting or when you're out and about doing something in your personal life, at work, you want to think about these three factors. I'm just planting seeds by mentioning these factors of force, repetition, posture as you go through this poll question. So on your screens right now, I'm going to release this poll question, and you can pick out an option for everyone who's in attendance right now, so you can see the poll question that just came up. And I think I know what the answer is when I was creating this poll question here, but I want to make sure when asking all of you, just kind of let's run this hypothesis right now and see what the case might be from everyone who's tuned in. So we have just over half of you who have responded to this poll question so far. I'll give you all a last minute chance. So if you're tuned into this webinar right now, you can see this poll question that came up has 5 answer choices. What I'll do is I'll close this poll in 3, 2, 1. Here we go. And what I'll do is I'll even share the results for all of you. And you can see here, of course, a number of you when it comes to work-life factors in this case, sitting for a prolonged period of time, and then as well as we have a little bit of lifting heavy loads, reaching and bending, and then even just holding the same position for an excessive amount of time. So all things to think about when we think about pain management, right? These are all positions and situations that certainly can aggravate our pain. Just going to hide those results, and you'll see the screen share again. And here we move on. And when we do move on here, I actually have another couple of questions for all of you. trying to make this really nice and interactive. And so we have some true-false questions. So we're going to start with this first one right here. So true or false for everyone tuned in right now, pain only occurs when you are injured. So let's see, I'm going to launch this poll. Everyone who's in attendance right now can see this question. Pain only occurs when you are injured. Give us another moment for all of you to vote. Okay, that's almost 100% of you voted. We're going to close the poll, share the results with all of you because I think it's nice to share these results. Pain only occurs when you are injured, and the answer is false. And this is certainly what we're going to talk about today. So pain does not only occur when you are injured. Okay, our second poll question right here is as follows, and I'll launch the poll. Worse injuries always result in worse pain. So that's worse injuries always result in worse pain, true or false? And I should say too, all these questions are based on a scientific paper too, so they're all evidence-based questions backed by science. Okay, almost 100% of you have voted. I'm gonna close the poll right now, and we're gonna see, share the results. Again, worse injuries always result in worse pain. The answer indeed is false. So worse injuries do not always result in the worst pain, which is why pain management is such a complex area of wellness and well-being. Okay, well, very last poll question right here, because I wanted to make sure I heard from all of you, get your input towards the beginning of this webinar. Launching this poll, and here we go. When you are injured, the environment that you are in will not have an effect on the amount of pain you experience. Again, while you are injured, the environment that you are in will not have an effect on the amount of pain you experience. Do you think that's true or false? Give everyone another minute or so, or another couple seconds or so, I should say. Okay, here we go, closing the poll. Sharing results. Again, false. And that certainly is the answer. So all these questions were all false as the answer. And that's when you're injured, the environment does have an effect on the amount of pain you'll experience. So kudos to all of you, 100% of you got that one correct. Okay, so we just finished our poll questions, and now we're gonna move on in terms of some practical steps for pain management. So far we established this idea of acute versus chronic pain. We talked about how it's important to lean into our chronic pain, not avoid it, not go through a spiral of things possibly getting worse and mismanaged over time. We want to lean into it. We're talking about, for the most part today, a lot of our musculoskeletal system, our muscles and bones, and the type of chronic pain that exists with that. We talked about some true-false questions, heard from you in terms of an audience poll, in terms of a lot of you mentioned sitting is something that is frequently, it puts your body in terms of your musculoskeletal system, what a typical day can look like for you. And so now we've identified chronic pain. What can we do now? You're thinking to yourself, okay, Nathan and the CG Zest Wellness team, what can we do for our pain management? We're slowly identifying it, and we're gonna go into that in our next slide right here. So here's what we created called a brief pain inventory. So I know it's a lot of text on this slide, but the purpose is that if you can think about each of these questions, maybe put down some notes, when you then speak to your own healthcare provider, you're that much more educated and prepared to describe your pain, explain the history of your pain, and describe in terms of things you've tried that do work, that don't work. And so overall, it's kind of you doing your own inventory of what this pain has looked like for you. And so 4 sections on this, and feel free to take a screenshot of this slide. The recording, of course, will be on YouTube, but these are questions you can ask yourself in terms of the quality of your pain on a scale from 0 to 10, the site of your pain, where is the pain, the timing of your pain, as well as different factors in regards to your pain. And so you go through these questions, and it's important because for each and every one of us, pain looks different to us. And so that's when we're speaking to a healthcare provider, such as our primary care physician, us just saying, hey, we're in pain, someone else could be saying the same thing, but these two scenarios, these two different people are different. And so you doing a brief pain inventory, you're ensuring that when you are speaking to a primary care provider, that you are describing your own unique situation the best and really being as comprehensive as you can. So you're doing yourself a favor, and I think you're doing yourself a favor by asking yourself these questions now, writing them down, creating, sometimes individuals create a pain diary too, and you'll even sometimes point out or draw a little stick figure of where the pain was on their body. So where do you feel the pain? And even on the top right of the slide, you can see just a simple image of a human body left and right from the front and back. And we're taking this whole idea again of a pain inventory and seeing how we can then approach our pain. Think of it almost like a pain audit, if you will. But where are we feeling the pain? What type of pain? Is it consistent? Does it feel a certain type of way? Is it moving anywhere in our body? Times where it has got better, what made it better? Things we've tried that just made it worse. We want to be able to be knowledgeable and speak to all these different areas of pain. That is our brief pain inventory right here. So a resource for all of you to have these self-reflective questions. We're going to move on to our next slide. And we're going to talk about another useful resource right here called a pain disability questionnaire, which is all about how you're actually affected by your pain. So another theme of this is when you speak to a healthcare provider, you can actually explain, okay, this is why my pain is impacting me in a certain type of way. Even if you're speaking to somebody in your workplace, it's important that you can reiterate to them maybe how your pain is actually affecting your working life as well. And so it's important to be able to speak to this and to use questionnaires like this to make these things top of mind. So what I'm going to do right now is I'm going to open up this pain disability questionnaire in a different tab. So here we go. And we're just going to go through the questions with you. So here's the pain disability questionnaire. And you can see it has 15 questions. Again, it's evidence-based from the research, and the questions on the lines of, how does this pain interfere with your work inside and outside of your home, personal care, traveling, sitting and standing, reaching for things, lifting, and even in terms of things in terms of even towards the bottom, recreational activities, seeing friends and family. How does this affect your mental well-being as well? Is it causing any emotional problems, social barriers? And so you're doing this you're going through all these different types of questions. You can print off this resource. We have it attached to the webinar here. And you can, again, do these numbers. And maybe it's one of those things where you complete this questionnaire once a month, once every 6 months, once a year, but you're putting a number in terms of putting a number behind your different areas of pain, and then you can track over time. And you might not think to yourself, okay, yeah, this pain, it is making me feel tense in my life. It is actually affecting my ability to walk or run. And so we're really trying to educate you and make it seem like that you're being empowered in terms of being able to speak about your pain, because when you can describe your pain and be more aware of it, then you're that much more in a position to explain that to others, and then a healthcare provider can that much more position to give you the appropriate treatment to act on your pain management and provide solutions for you. So that is the pain disability questionnaire for everyone. What I'm going to do as well, because really want to be practical with this webinar, is before I share the presentation again, I'm even just going to share another resource that we have from our CG Zest Wellness team, from our team members, Sharon Looney and Katie Titterton here, who created this chronic pain log. And so another part of pain management is being able to track pain over time. So certainly encourage you to print off this resource. This resource is attached to this webinar, and you can see that we can track our pain and we can have a pain rating like the above scale shows. And we can describe the pain, again, look at the location, just like our pain inventory, possibly identify pain triggers, the duration, any remedies, any medication or other concerns. When we can do this and track this over time, again, we're that much more put into a situation of being able to help ourselves and explain how, and then someone else can then identify how they can help us as well and provide solutions for our pain management. So another useful resource, this chronic pain log, to help with our pain management and think to ourselves, okay, how are we tracking if we're trying something new or trying something different? How are we tracking if things are improving or not over time? And even towards along the top, we can always ask ourselves from 1 to 10, how are we looking at our pain? Is it no pain, mild pain, moderate pain, severe pain, or is it the worst pain imaginable? And maybe this is a weekly pain log, a daily pain log. For each person is different, but we're really trying to put some documentation around our pain as a useful resource for us. We're doing what we can, our self-management of the pain. So I'm going to go back to the presentation here. And again, these two, the pain disability questionnaire and this chronic pain log, are both within this webinar. They're both within the handouts section for you to download. Okay, so we went through the pain disability questionnaire, how pain interferes with your everyday activities, showed you the chronic pain log here from our CG Zest Wellness team members, Sharon and Katie, who created this a little while ago. And then now what I also wanted to share with you for your pain management is another resource that we have through the CG Zest Wellness platform, powered by Virgin Pulse, and that's the Journeys feature. And if any of you have done the Journeys feature, it's a digital health coaching feature where it's one self-guided tip each day. And so the full duration of those days acts as a self-guided course. And so you complete one tip per day. And you can see that there's a number of amazing topics on back, muscle, and joint health. Things like beating lower back pain, easing arthritis pain, moving better with arthritis, and then repetitive strain injuries, RSIs. And of course, what's amazing too is that when someone completes the journeys within the platform, they get points. And so when you complete a journey step each day, 15 points. When you finish a whole journey, and you can see the durations up there, 10 days, 10 days, 14 days, 13 days. When you create a whole journey, you get an additional 250 points. Again, in addition to each of those daily points, you're getting each of those daily points across that whole duration. And then again, as a bonus, you get the 250 points for completing a whole journey. But it's amazing how there's a number of topics on something like pain management for back, muscle, and joint health. And so some great resources from Journeys right there for you to think about. In terms of some other type of pain relief options, because we just talked about doing a pain inventory, we talked about doing a questionnaire of your pain and how this affects your life, doing a pain log of tracking pain over time. We talked about, okay, in terms of what you can do, there's Journeys. What you can also do, of course, are a number of pain relief options in terms of speaking with a healthcare provider. Lifestyle changes, first and foremost, which is exactly what the CG Zest Wellness program is all about. Lifestyle changes in terms of exercise, stretching, nutrition, sleep, and stress management. And it's interesting because that point about stress management there's a number of recent research articles and that have shown that this idea of pain management, pain is so heavily connected to emotions and cognition, so how we're thinking. And so it's amazing that we have something like pain like this, and it's connected. There's a whole neuroscience behind it, connected to the brain. And so that's why something like stress management does play into lifestyle changes, just like exercise, just like nutrition. If you're actually thinking about even right now, lifestyle changes in terms of nutrition, there's also uh, foods that are high in omega-3s, foods that are high in calcium and vitamin D, like broccoli. Omega-3 heavy foods would be foods like fish, as well as nuts, and then nuts as well have higher protein content too. And then even never underestimate olive oil too. Amazing for healthy fats and omega-3s, just in terms of a little bit of nutrition there. But in addition, for more pain relief options, we have RICE, which stands for rest, ice, compression, and elevation. In terms of if you have any sort of flare-up with your pain, or in terms of assistive devices like braces for your pain. Of course, different types of paramedical providers, physical therapy or physiotherapy, massage, chiropractic, or cognitive behavioral therapy, CBT. And of course, that gets at this idea of pain being this complex interplay with emotion and cognition. So we want to make that apparent, and that's why you see something like CBT on this list. And then, of course, medications, pills, creams, or injections that might be recommended by a healthcare provider, and in some cases, surgery as well for certain types of chronic pain. And so these are all pain relief options. So for the remainder of this webinar, we're going to focus on lifestyle changes and what you can do in particular. Okay, we just talked on this slide about this idea of stress management, CBT, and pain management being this interplay with emotions and cognitions. Want to make that apparent for everyone. And that goes with a lot of neuroscience in recent years in terms of pain management, and in terms of how this really, the nerves in the body, how this really impacts this part of it. And so I wanted to share this slide, which shows how what's called your nerves can become sensitive with chronic pain over time. And so usually you have this buffer room, just want to show some fun neuroscience here. You normally have this buffer room of pain, but when you decrease that buffer room, your nerves become extra sensitive, and therefore extra sensitive to pain. And so there's this heavy influence in science lately about this neuroscience of chronic pain. And so what can we do to make our nerves less sensitive? And that's why there's things like, of course, exercise, but also relaxation, meditation, and these different types of lifestyle changes that go into wellness that we can do to help with, in this case, with our nerves, to help them become less sensitive and increase the buffer room. That way we don't become so sensitive to pain, and we really have this cognitive and emotional control of our pain, for our pain management. So some really interesting research when I was creating this webinar on this topic of the neuroscience of chronic pain, and how the mind and the body play a part in pain management. What we'll do is we'll move on here to kind of continuing this topic, and that's why I also wanted to mention with this webinar is when you're going through your pain management and you're acting on it, which is what this is all about, consider self-care. And so there's things like deep breathing, positive self-talk, mental rehearsal, in terms of going through what ifs, and making sure that you really run through scenarios and put your mind at ease through how scenarios can really go, in addition to goal setting. And so even included an action plan here for a goal setting sheet, in terms of when you have pain management and you have days where your chronic pain is flaring up, we can set goals, and that's how we can, through tiny actions and tiny small wins, manage over time and ensure that our quality of life is as best it can be with our state of chronic pain. And so even include an action plan right here. And again, feel free to take a screenshot of this when you're thinking about a new type of wellness strategy or lifestyle change to undergo. You know, what do we want to do? How much of it? When do we want to do it? How often? Whether it's these strategies here or it's, you know, of course, exercise and journaling and sleep and different types of meditation, mindfulness as well. What can we do? But to never lose sight of self-care, because I said earlier at the part of this webinar that self-care is not selfish. And so what we want to do is with our whole body, thinking holistically, our mind and body, we can consider our self-care strategies to help with our pain management. Even with this one, you can see with your action plan here, when you're creating goal setting and you're considering self-care, when you're doing something, even asking yourself, how confident are you from 0 to 10 here? So for a full action plan, let's say for myself, it might be to, okay, what do I want to do? I would like to become more physically active, exercise, which is a little bit of a sneak peek to our next slides are going to be. What do I want to do? I want to exercise. How much? It's going to be a 20-minute walk, let's say. When? In the mornings. And then further to that, how often? It's going to be each morning, or it's going to be, you know, every other morning. And then how confident am I? I'm confident that could be an 8 out of 10. Same thing could be if I wanted something nutrition based. What do I want to do? I want to consume more fish and have that protein as well as those healthy fats, the omega-3s. How often? Twice a week. When? For dinner. And how much is going to be, as well as it's going to be okay. One piece of fish or whatever portion size that I decide on. Even further to that, it could be I want to call a friend for my social well-being. It could be that I'd like to have a gratitude journal and have doing a certain number of times per week. And that might be in the mornings, afternoons, at lunchtime, after work, before bed, when you wake up. But it's getting granular with your action plan and ensuring that you're setting yourself up for success and taking care of yourself through goal setting. But all to say is that self-care is important when it comes to pain management. Okay, and then we'll move on to ergonomics here. So I also want to cover ergonomics with everyone, and that's what we did the earlier poll question about, okay, hey, in your daily working life right now, when it comes to 3 things, your posture, the force frequency, you even have something like ergonomics, which is what is important to many individuals. And so first thing when it comes to ergonomics and thinking about ergonomics for our pain management in terms of sitting during the day in our working life is that we want to do everything we can to maintain a neutral position, it's called. So that's when the body position has the highest support to handle the pressure felt by the supporting structure while causing the least amount of strain on the muscles, tendons, and ligaments. And you can see some images on what this neutral position looks like, and we can alter that neutral position a little bit during the day. And then as well with the middle image here, you can see that when you're hunched over, how much pressure that can put on the discs within your back. And so you can see in the middle image there that when someone is 100%, when someone is standing upright, straight up, that is considered baseline of 100. But then when that goes up, when you tilt forward, when you're holding something, and so even when you're sitting and your posture is not at the neutral position, you can see I was putting additional strain on your lower back there, thus leading to musculoskeletal disorders like lower back pain. And so that's why ergonomics is important. What we did with this webinar for all of you, and a resource we created throughout this pandemic, this COVID-19 pandemic, is we created our Zest Wellness team a at-home checklist for ergonomics. So I'm going to share this checklist right now with all of you. And again, this is attached to the handouts part of this webinar, so you can download the checklist. And you can see here, this ergonomics at-home checklist goes through different factors like your workstation, like your chair, asking you all these different questions. Continuing on here to the second page, it asks you about your monitor, or if you're using a laptop device. Asks you about lighting in terms of ergonomics. So very much dealing with your workstation. And then the third page right here, this section is called Other, and it's all about, okay, if you're reaching at any point during the day, if you have a standing arrangement, even ergonomics. Part of ergonomics is taking rests and breaks, as what does your workflow look like throughout the day? What about the temperature of your workspace, the air quality of your workspace, the keyboard itself, your mouse, and then even if you're using a telephone. So really gets that kind of, you're at home, whether it's in your office, or in this case, even we made this and branded it as the at-home checklist. And when you're going through this for your ergonomics, is what is your body doing throughout the day? And if you work, a 7 to 8 hour day, 5 days a week, you can see how ergonomics plays a part in pain management and for musculoskeletal disorders. Because it's not that there's like a high force or being injured or anything like acute pain. With chronic pain, is even if something is of low force, we're doing something repeatedly over time, that's how we can have something arise in terms of pain. So it's not always the high force, it could be the low constant force, or the low force with repetition that then leads to chronic pain as well. So really trying to get that point home about why ergonomics is important and why we have this ergonomics at home checklist. So again, it's in the handouts part of this webinar, and all of you can download that and go through that checklist yourself, with the overall goal being if you could take away some 1 or 2 tips from this in terms of how to improve the ergonomics of your workspace, then that helps you with your pain management that much more. Okay, so right now I am going back to share screens for this webinar. There we go. Okay, so covering ergonomics in terms of pain management. What I also wanted to share with this webinar too is, of course, something that's important to myself and our CG Zest Wellness team, and that's movement or exercise. And to help put a novel spin on this to share with all of you is we have exercise and we have physical activity. And what comes with physical activity is just overall movement. So not all movement or physical activity has to be exercise, because exercise is more structured. But what we want to do is go from just simply thinking it's only about exercise to thinking, hey, physical activity in general is what's important. And even in addition to that, it's not about just that 1 hour of physical activity a day, but how can we have a full 24 hours of being healthy and having this thing of this thinking of a healthy 24 hours. And so that's what the 24-hour movement guidelines are all about, which is created by the Canadian Society for Exercise Physiology. And so when we're thinking about our musculoskeletal system and incorporating movement throughout our day, our goal is looking at, starting from the left right here, from sweat, step, sleep, sit, is we want to sweat. So the exercise recommendations in this regard for aerobic exercise, which is things like running and walking, or on a bike as well, is at least 150 minutes per week. And then strength training using weights and whatnot is at least twice a week. But it's not just about just sweat, it's also even lower intensity activities like simple steps and walking and standing also matter. And so we have sweat, we have step, right? And that can include, again, walking and standing. We also want to include sleep. Sleep is a part of this, healthy 24 hours and 24-hour movement guidelines. So 7 to 9 hours of sleep per night with consistent bed and wake up times, very important. And then further to that, limiting sedentary time. So just simply sitting to 8 hours or less per day, which includes no more than 3 hours of recreational screen time. So for many of us, that's our screen time in the evenings, and then breaking up long periods of sitting as often as possible. So for all of us, including myself, after this webinar, we're gonna get up, either go grab a drink, go do something else, drink in terms of water perhaps, go do something else, and we're gonna just move our feet. That way we're breaking up our sitting time, if you are sitting right now, as much as possible, limiting our sedentary time. So if you're gonna be doing any sort of sweating and increasing your heart rate, it's 150 minutes per week is the recommendation. Strength training at least twice a week, and then each day, of course, several hours, much as we can, to get our steps, standing, breaking up that sitting time and screen time, and sleeping that 7 to 9 hours, which makes up our 24-hour movement guidelines. And this is important because you can see on the top right of the screen, there's a report from the Pan American Health Association, and here's a few client jurisdictions that we operate in with CG. Then in terms of individuals who are having an insufficient, not enough amount of physical activity, you can see that those numbers right there. So that's where our goal with the CG Zest Wellness program and webinars like this, which are a part of the program, is to provide education and resources and empowerment, building a community of doing all of this together and making each other better as we go along. As I always like to say to individuals, a rising tide lifts all ships, and so as we're empowering ourselves with our healthy habits and we're being our best selves, maybe that can be contagious to someone else, and our healthy lifestyle can then inspire them as well. So keeping in mind, these are our 24-hour movement guidelines. It's about not just sweating, but also our steps count, our sleep counts, and breaking up our sedentary time, certainly without a doubt matters as well. Now, speaking of which, we've all been, at least even for myself, been sitting so far during this webinar, and we talked about the importance of ergonomics and movement for our pain management. What we want to do as well is share some desk stretches that can be good for all of you, and I'm going to literally do these myself right now. So we're starting from the first one right here. You can do a posterior shoulder stretch, some shoulder shrugs, a shoulder extension, or two types of shoulder extensions. So you can see right now, if I do this with you right now, I can do a nice shoulder stretch. And maybe this is something you do at lunch each day for a few moments, possibly with colleagues for a morning huddle, right? I'll do my shoulder shrugs right now. I'm actually wearing one of my favorite floral shirts. So I'm doing my shoulder shrugs, right? I'm doing this even while sitting. Something that could be done at the end of the day as well. And of course, shoulder extensions with your palm up. And then since I'm sitting right now, I won't just do or I will actually, I should say, I'll do this back shoulder stretch, but even by putting my back hands behind my chair, I can really stretch out, because this is important, because with our, whether it's our upper body or lower body. We want to make sure that we maintain our range of motion and that we're not compromising that over time in terms of our musculoskeletal health. Because when we become more stiff over time, we can feel more pain over time, and that's certainly something we do not want. So for our pain management, of course, flexibility and stretches are important, and we can even do those from our desk when it comes to upper body stretches, and there are lower body stretches that can be done too. Okay, I'm going to move on to our last slide right here. Really appreciate everyone's time, and that's just to share that with all of you, we've been chatting about what you can do today for your pain management. What I also want to share with you, what we do in terms of the CG Zest Wellness team, is we would like to work with clients and employers. And for some of you, you might be champions, or you might be individuals who work with various individuals from our CG Zest Wellness team. And we always like to create sessions and have conversations, create strategies on, okay, for employees, what can we do to help with their pain management? And so if you're listening to this webinar and you are a champion, like I mentioned, or you do speak to one of our CG Zest Wellness team members, we can create an employer strategy for you and include things of, okay, yeah, we're going to do a topic of pain management. And these are going to be our initiatives. This is how we're going to measure success. We can create a whole employer strategy on supporting our employees throughout the day. And maybe that ergonomics is a part of that. Maybe we do something for our employees in terms of proper lifting techniques, or we provide different sorts of assistive objects for any employees even need accommodations. And so we really try to think about these different types of questions when we work with clients to get different resources out there, provide supports to employees of all the different companies that we work with. And that's what this slide is all about, is sharing that we like to do webinars like this. And we also like to work with clients in order to help them take care of their people, to take care of you too. So it's both speaking to the employee yourselves, and then also speaking to employers and how everyone can support each other, which is what the CG Zest Wellness program certainly is geared to do. So with that said, for everyone, that brings us to the end of our content for the webinar. We have a few minutes for Q&A. If you want, you can use the questions or chat feature of this webinar to ask, and I can either share with you an answer or share with you where you're able to find an answer in terms of further resources. I'll share with you again on this slide that the handouts part of this webinar included the 3 resources that we covered: the pain disability questionnaire, the chronic pain log, and in turn also the ergonomics checklist. So all those 3 resources are in the handouts section of this webinar that you can download. And then as well, in terms of just more education, more fun stuff from the CG Zest Wellness team, we have our Instagram, email newsletter, Facebook page, blog, podcast, and then further webinars, which this one, including all the webinars we've already done, the recording for them are all on our YouTube page. And so with that said, I'll give another moment if anyone wants to ask any further questions with this pain management webinar. And hopefully everything from journeys to sharing the self-care strategies and talking about the neuroscience of chronic pain and different pain relief options when you speak to your healthcare provider, and the idea of movement and flexibility and exercise coming into this too. Hopefully it's one of those, this webinar is a valuable resource for the lifelong journey of pain management when it comes to chronic pain. Okay, everyone, I don't see any questions, which is totally okay. It was a pleasure to deliver this webinar to all of you, and thank you a bunch for joining in. We'll be sure to have further and additional webinars from the CG Zest Wellness team. And then again, here are all of our online resources shown on this page right here. And so from that said, for myself, Nathan Kolar from the CG Zest Wellness team, that concludes another webinar. And in this case, our webinar on pain management. Bye for now, everyone.